Hello, thank you for watching this channel. Hey, I've got some news for you that's not so good for a lot of people who are wanting to come to the United States. The Trump administration has now announced that they are going to begin requiring anybody coming to the United States beyond a 30-day visa, or beyond a 90-day visa or visitor's visa, they are going to be required to have health insurance. So that changes a lot of things for a lot of people throughout the world. If you have a fiance visa, if you have a lottery visa that you're attempting to get, K1, all kinds of different types of visas, this is going to affect you dramatically because you need to have health insurance for a year, and you need to be able to prove that you have health insurance for a year. Now, most health insurance in the United States is basically impossible for anyone outside of the United States to purchase. It's going to be very expensive. But there are other programs out there. There is a company called Cigna, C-I-G-N-A, Cigna, and you can contact their company, look it up online. They're probably one of the best, and they do provide health insurance for people, foreigners coming to the United States. They provide international health insurance. Bing and I have looked into it, and our costs for us, if we're in the Philippines or somewhere in the world, it's about $300 a month. We're in our 60s. And the rates don't increase dramatically through the years. And it's a lifetime benefit if we want it. There's no cutoff date in our lifetimes. We have all pre-existing conditions are not covered, but things like blood pressure and so forth are not an issue if it's under control. So you can pay for basic coverage, which means emergency care, hospital care, that kind of thing, for about $300 a month for us, our age, in our 60s. Doesn't go up much through the years. Or you can pay more if you want to have companies that provide all kinds of medical medications and things like that. Not a lot more, but you do pay more. Cigna will go to the company that you're with, the medical center that you're with. Let's say it's Davao Doctors Hospital, and they are registered with them. So they will go to them and put your name on the registry so that if you ever go to the doctor there, it's covered. And same with a lot of hospitals throughout the Philippines and many throughout the world. So not all hope is gone, but it is discouraging because if you're on a fiance visa and you've got some young man that you want to marry and he only has a basic job that he's going to have to pay your premium for a year, that's probably going to be about $100 to $150 for a young person. So it's unfortunately, this is the way it's going for a lot of people coming into the United States now. This makes it almost impossible for many people, and I think what it's going to do is going to change the geography of many people in the United States. They're going to probably relocate to foreign countries in order to get married, and their fiancés, instead of the fiancé coming to the United States, they're going to go to the other country. Problem with that, of course, is that employment for young people is very difficult in other countries, and for older people, healthcare is an issue. So the older person should have some kind of health coverage of some kind if he goes to a foreign country, he or she. So that's something to consider. There is in the Philippines, there is PhilHealth. It's a basic coverage. As a senior citizen, you get discounts. But still, if you're in the hospital and you have a injury or a serious injury or a health condition, they are going to want the money from you before you leave that hospital. And that is just the way it is, because they don't have subsidies as America does. It's kind of unfortunate, in my opinion, because the United States has subsidies given to nonprofit hospitals throughout the United States already. Many hospitals and medical centers are nonprofit, called not-for-profit. And they receive subsidies from the U.S. government. And when you go to a hospital or medical center that is not-for-profit in the United States, you can receive what's called a sliding scale cost benefit. And all you do is apply for that sliding scale. So even if you come to the United States and you do have insurance, that's going to still be available. But it's unfortunate, in my opinion, because the idea that it saves the taxpayer money is not really the case, because the companies are already a nonprofit. They receive federal funding, these hospitals do. And so it's a little disingenuous, in my opinion. In my opinion, what it really is a way to keep migration out of the country. And I think it's sad, because there are so many people who have fiancé visas and things that they're doing for their future. And it's going to change a lot of things for a lot of people if they can't afford to have insurance. But I know a little bit about this. I've sold insurance in my life. I work for a nonprofit company. We have to have 75% of our employees have to be disabled. And our company wants disabled people so that we can receive the nonprofit status and the federal funding. So a nonprofit hospital or clinic is no different. They want people to come in that need to have sliding scale assistance, lower income assistance, in order to receive the federal funding. So in my opinion, it's disingenuous. It is a way to keep people from coming into the United States. But that is the case. And hopefully you can afford, say for younger people, $100 to $150 a month to have catastrophic insurance. It doesn't apply to visitor visas. Fortunately, not yet. It may in the future. So, something to be aware of, and definitely talk to an attorney if you're thinking about coming to the United States. It's really time to go through an attorney. It's really the only way to do it now. Or a special fiancé visa person, not to try to do it yourself, in my opinion. So, and same with any other type of visa as well. Thank you for watching. If you want to get the details on the new law, go to www.whitehouse.gov, and you can read the details of the new law. Thanks a lot for watching. Have a good day. Bye-bye.